South Africa's mines have long been associated with conditions that create serious health concerns for mine workers, ex-mine workers, their families, and those living around them. In the underground mines, the combination of extreme heat, prolonged exposure to fine dust, and close working proximity expose mine workers to the spread of tuberculosis, TB. Mine workers in South Africa have the highest TB infection rate in the world, estimated at 3,000 cases per 100,000 people. These numbers far exceed the World Health Organization's threshold for a health emergency, which is 250 cases per 100,000 people. We have a serious epidemic.
Stop. Lo engine inaphelile. Lo engine is clar.
Many mine workers test positive for tuberculosis, which is a highly infectious disease that easily spreads through air in overcrowded underground mines where mine workers spend most of their time. Godfrey Tolang, a current mine worker who has twice been infected with TB, speaks of the effects of fine dust in underground mines.
Keep out fire stove. We will up. You're up cozieti.
In Tokosisi Ngema, current mine worker with multi-drug resistant TB, speaks of poor ventilation in the underground mines.
First, if we are khohlela, umoya wasemgodini awukhona ukuphumela esafesi. Unexesha lokuphumela esafesi. Mase bokhipha bona belungu ngemishini yabo. Uma ukhwehlela kuyarotate in the base.
The prolonged hours of work underground under unbearably extreme heat conditions also affect mine workers.
After 8 hours, we are 9 hours, 10 hours, 12 hours. There
is also a lot of misinformation regarding TB among mine workers.
Mine workers in South Africa come from different countries and cultures across Southern Africa. They speak different languages. There is significant misinformation regarding how TB is acquired, with some saying that you get it through witchcraft.
An observation supported by Mr. Pamawa.
The level of education. Yeah. Most of the things when they come with the English words. Some other people, they don't understand the English word.
This misinformation among the mine workers on HIV and TB also leads to stigmatization among TB-infected mine workers.
And most abantu abanayo bakhona lapha bayesaba ukutesta. Because why? Umuntu won't mayo test once wafika test or two ni TB, another kuthiwa hambo testa AIDS.
Accommodation remains a huge challenge due to overcrowding and poor sanitation for some mine workers.
Most mine workers either live in hostels provided by mining companies, or they receive an allowance to stay at a place of their choice. In order to save money, the majority choose to stay in slums. Often, the hostels are also overcrowded. These poor living conditions in hostels and slums contribute to the spread of TB.
Infected miners further spread the disease to their families and communities in the rural areas when they return home. Mr. Tolang narrates how he discovered he had TB.
TB, 2010, December.
Even though he successfully completed his treatment in 2011, Mr. Tolang says he was reinfected in less than 2 years.
August. It was my foot.
Once diagnosed with TB, mine workers face other enormous challenges.
I have 3 friends who are infected, and they are not longer working. because their TB is not a TB that is curable.
Because of a prolonged treatment period for TB and multi-drug resistant TB, mine workers face serious financial challenges.
There's no income in my house. My kids are suffering. The mine have been frustrating me so much.
Mining companies are working to improve the working conditions for their workers.
I think the biggest challenge is that TB is not just in the mining. You know, TB is in the peri-mining, TB is in the community. And if it's in the community, the only way to address TB in the community is to all stakeholders, you know, to put their hands together around TB, HIV, to address it.
We have established a partnership consisting of governments, namely Ministries of Health, Minerals and Labor from Southern Africa, mining companies, mining unions, ex-mine workers association and development partners to collectively address this 100-year-old problem.
We have a serious epidemic.
For anyone who suffers from TB, stick to a treatment. That's the only cure.